Heart failure is a chronic condition where the heart is unable to pump blood effectively to meet the body's needs. This can lead to a buildup of fluid in the lungs and other tissues, causing symptoms such as shortness of breath, fatigue, and swelling. Heart failure can result from various underlying heart conditions and is often a progressive condition that requires ongoing management. Types of heart failure: left-sided heart failure. Characteristics: the left side of the heart is unable to effectively pump blood out to the body. Symptoms: fluid buildup in the lungs, pulmonary congestion causing shortness of breath, and sometimes a cough. Right-sided heart failure. Characteristics: the right side of the heart is unable to effectively pump blood to the lungs. Symptoms: fluid buildup in the body, peripheral edema causing swelling in the legs, ankles, and abdomen. Congestive heart failure. Characteristics: the term used to describe heart failure with symptoms of fluid buildup, often affecting both sides of the heart. High output heart failure. Characteristics: occurs when the heart pumps an unusually high volume of blood, but still cannot meet the body's demands. It's less common and typically associated with conditions that increase blood flow. Causes: heart failure can result from various underlying conditions, including coronary artery disease (CAD), narrowing or blockage of the coronary arteries, reducing blood flow to the heart muscle, hypertension, high blood pressure. Long-standing high blood pressure can lead to thickening of the heart muscle and eventually heart failure. Heart attack. Damage to the heart muscle from a previous heart attack can impair the heart's ability to pump effectively. Cardiomyopathy. Diseases of the heart muscle that can impair its ability to pump blood. Valvular heart disease. Problems with the heart valves, such as stenosis or regurgitation, can lead to heart failure. Arrhythmias. Abnormal heart rhythms that can affect the heart's ability to pump effectively. Congenital heart defects. Structural heart problems present from birth can lead to heart failure. Myocarditis. Inflammation of the heart muscle, often caused by infections or autoimmune diseases. Chronic lung diseases. Conditions such as chronic obstructive pulmonary disease (COPD) can contribute to heart failure. Symptoms of heart failure can vary but commonly include shortness of breath, especially during exertion or when lying flat. Can also occur at rest in advanced cases. Fatigue and weakness. Feeling tired and weak, particularly during physical activities. Swelling, edema. Fluid buildup in the legs, ankles, feet, or abdomen. Coughing or wheezing. Persistent cough or wheezing, often worse at night. Rapid or irregular heartbeat. Palpitations or a feeling of a racing or irregular heartbeat. Reduced ability to exercise. Difficulty performing activities that were previously manageable. Nausea or lack of appetite. Feeling full or having an upset stomach due to fluid buildup. Diagnosis of heart failure involves medical history and physical examination. Review of symptoms, medical history, and a physical exam to check for signs of fluid buildup and heart function. Blood tests. Beta-natriuretic peptide (BNP) elevated levels can indicate heart failure. Other tests to assess kidney function, liver function, and electrolyte levels. Electrocardiogram (ECG) to evaluate the heart's electrical activity and detect arrhythmias or previous heart attacks. Chest X-ray to check for fluid in the lungs and assess the size of the heart. Echocardiogram, an ultrasound of the heart to evaluate its structure and function, including the ejection fraction, the percentage of blood pumped out of the heart with each beat. Cardiac MRI or CT scan to provide detailed images of the heart and assess for structural abnormalities. Stress test to evaluate how the heart performs under physical exertion. Treatment for heart failure focuses on managing symptoms, improving quality of life, and addressing underlying causes. Medications. Diuretics to reduce fluid buildup and decrease symptoms of congestion. ACE inhibitors or ARBs, to lower blood pressure and reduce strain on the heart. Beta blockers, to lower heart rate and reduce workload on the heart. Aldosterone antagonists, to help reduce fluid retention. Inotropes, to improve the heart's pumping ability in severe cases. Lifestyle changes. Diet. Low-sodium diet to reduce fluid buildup and manage blood pressure. Exercise. Regular physical activity tailored to individual capabilities. Weight management. Monitoring and managing weight to prevent fluid retention. Medical devices. Pacemakers, to regulate the heart's rhythm. Implantable cardioverter defibrillators ICDs to monitor and correct dangerous heart rhythms. Cardiac resynchronization therapy CRT to improve the heart's efficiency by coordinating the contractions of the heart's chambers. Surgical and interventional procedures. Valve repair or replacement, for patients with significant valvular heart disease. Coronary artery bypass grafting CABG for patients with severe coronary artery disease. Left ventricular assist devices LVADs mechanical pumps to help the heart pump blood in advanced heart failure. Heart transplant, for patients with end-stage heart failure who do not respond to other treatments. Preventing heart failure involves managing risk factors and adopting a heart-healthy lifestyle. Healthy diet. Eat a balanced diet low in saturated fats, cholesterol, and sodium. Regular exercise. Engage in regular physical activity to maintain cardiovascular health. Control blood pressure. Monitor and manage blood pressure through lifestyle changes and medications if necessary. Manage diabetes. Keep blood sugar levels under control. Avoid smoking. Quit smoking and avoid exposure to secondhand smoke. Limit alcohol. Drink alcohol in moderation, if at all. Regular checkups. Have routine checkups to monitor heart health and manage existing conditions. Conclusion: heart failure is a serious condition that requires comprehensive management to improve symptoms and quality of life. Early diagnosis, appropriate treatment, and lifestyle changes can help manage heart failure effectively and prevent its progression. If you experience symptoms of heart failure or have risk factors for the condition, it is important to consult a healthcare provider for evaluation and management.